Good day. Welcome to the MagnaWave office hours for this Tuesday, Thanksgiving week. But that's the last mention of that, so people don't get confused on when they're watching the various programs. But anyway, I'm Pat Zemer, CEO of MagnaWave. Glad to be here with you to answer any questions that you may have with regard to PEMF therapy, MagnaWave, devices, training, whatever those questions may be. We're here to answer your questions. Now, you can either put your question in the chat box on YouTube or Facebook, or you can send me a text at 502-599-9722. 502-599-9722, and I will phone you back, and then we can have a discussion about whatever it is that you would like to talk about. So we're happy to do that. So again, put it in the chat box. I will see the question, be able to answer it, or you can send me a text and I will be happy to call you back and have a discussion about whatever it is that you would like to talk about. So please feel free to do that. If you're here with us, please share this broadcast with your friends so they will be able to come on and have their questions answered as well. If you have a customer that you're wanting to learn more about what's going on, it'd be a great thing to share it with them so they could potentially chime in and hear what's being discussed and get some better clarity about MagnaWave and what it can do for them. So we're glad to be here, and we want to certainly, as I say, answer your questions. There were some questions, some things that have come up this week, but before I go there, let's talk about MagnaCon coming up in June of 2021. Our plan at this point is to have a live in-person MagnaCon. Hopefully, they're talking about vaccines and everything being in place. Hopefully by May, things will start going back to normal. So with everything moving along, we certainly hope that we will be able to have MagnaCon as we have in the past, live in person in Louisville, Kentucky, and then also virtual at the same time, because there are a lot of people that no matter what's going on, they just can't get away from their business or can't get to Louisville to be here with us in person. So we're hoping to expand everything in that manner come MagnaCon 2021. Tickets are on sale now. If you buy before the end of the year, you get a $100 discount on your tickets. So if you want to save a little money, simply jump in and buy your tickets now. It's on the website available. I'm sure Chris will put a link in this as well, so you can go and at least check out the cost and potentially buy your tickets for MagnaCon 2021. All right, let me go over here and have a look at some questions. Let's see if we have any questions coming up this morning. Good morning, Samantha. Lydia's with us. Great. Dion is with us. Tracy's with us. John Stevens is with us also from Europe. We're told, John, just within a week that we'll have the European CE information. That's what I was told yesterday. And as you know, we are now Health Canada, so that's a good thing. So it's coming right along in that regard. So I hope that'll make you happy. And Elaine and I have been discussing Europe and your type of situation, and we want to visit with you and see how we can help you with your business and expanding what you're doing there. All right, serious? John says with a question mark. I was told serious. So Sue's with us from North Carolina. Kate's with us. Good morning from Florida. And Carrie is with us as well. So we're always glad to have you folks with us. Emily's with us on CastBox. The folks listening to CastBox in a radio fashion as opposed to watching video on Facebook or YouTube. Okay, let me come over here. There have been a few questions that have been asked. One practitioner was talking about a 2-year-old paint mare with bad case of scratches on the leg. The vet gave the owner a topical ointment, antibiotics, and bute 10 days ago. She did a full body session 8 days ago, which helped with the swelling. Now the scratches have come back horribly after the weekend. Owner has asked me to come back today and do another session. She has used all the prescribed topical ointments, and the vet is calling the vet again today with the photos that she sent in. Has anyone had experience working with horses like that, or with scratches, or those types of skin irritations? Most certainly we have. Certainly, I would think that some type of topical oxygenating thing can help with this, potentially like HydroWave as a wound spray to spray on it. But if they've already used topicals, that's a good thing to do. Obviously, if you had some swelling improvement by doing a full body session to be able to treat more often than perhaps once a week would serve to be beneficial. And I would treat right over the area. If you got a spot that you're having having, for example, we've had situations with people with shingles, and you treat right over the shingles because the shingles itch and they're painful because of inflammation. So if you treat right over the area, you can have some benefit with inflammation that they're experiencing from the scratches. So I would also take a look at a good topical ointment that they've already used, and they're maybe going to use some more, but I would suggest perhaps some MagnaWave. And the LZR, if you have an LZR light available, the light right over the wound may be beneficial in helping the healing process. And someone wrote that it could also require a culture to make sure there's not something going on there that we can't, that's anatomical or somewhere else, and it's showing up there in forms of an abrasion or scratches, itching like that. So great question. And those are some things that you could do. I would treat right over the area as often as possible to do that. Let's see here. Person asked a question. They train, do horses will respond differently with each treatment, and thus not to treat a horse for the first time at a show. Same with massage therapy. If a horse does in fact act poorly after a couple of days after treatment, what's the best way to explain to the owner and keep them coming back? Is there anything to change to minimize that effect on some horses? Well, the issue on treating at shows, I mean, I go back to when I first began, and I would treat at shows. I'd treat the day before they competed. I'd treat the day they competed. And the number of times that I would have an adverse situation at a show was minimal. I would get a good situation more often than not. However, I would like to point out that the best thing to do is to be if you're 6 to 8 hours out, or an evening before or a day before a competition, rarely is there an issue. Now, if you have a horse that's having some issues going on that you don't know about, and you treat them and they're sore or they're not good for a couple of 2 or 3 days, that would be an indication. We had that type of situation a lot in the beginning when we would work with horses that had EPM. We'd treat them and they wouldn't be any better, and for a couple of days. And so we would have to treat them more often. So the number of times that I've personally experienced that type of situation is very low. But I would also recommend that is if a horse is going to, if someone wants their horse to have an edge and they don't want them to be too calm, you don't really want to treat them an hour before they go to the ring, or maybe the afternoon. If they're competing at 2 o'clock, you don't need to be treating them at 11 o'clock. Now, once you've learned how a horse reacts, then you can treat them whatever the best time for a horse. And I've told this story a number of times. I had that happen at the racetrack. Trainer calls me up, my horse is racing this afternoon, come treat it. I went out and treated the horse. Horse went to the racetrack, didn't really care if it was on the racetrack or not, because I kind of took the edge off the horse. The next day, the horse was really ready to go and ready to do things. I've had that with hunter jumpers. I've had that with dressage horses. But I learned that if you could go 6 to 8 hours out, or the evening out before, very rarely would you have that type of situation, unless, like I said, something else is going on that can cause this to surface, and EPM or something like that, that's going to allow them to be sore for a few days after a treatment. And if that's the case, if I treat a horse 3 times and they don't start showing some improvement, then we talk to the vet. We make sure that they talk to the vet to find out that there's not some underlying causes to that type of situation. So that would be the best thing to do, is to certainly make sure you're far enough out. Now, if you're working with a trainer that you know, and they know you, and they're going to use you, and the best thing to do is they're going to work the horse tomorrow at noon, treat it tomorrow morning, and see how the horse does. And then the next time, treat the horse the night before training and see how they do. And many times, just that distance, just that difference of treatment times makes all the difference in the world. I've told the story about Busy, who had a horse in St. Louis, and she wanted a horse treated, and we were getting a lot of good results with the owners and the horses. I treated her horse. She went to the ring. The horse didn't care about even being in the ring. But the next day, the horse jumped like a world champion and really performed well. So she learned that she needed to treat her horse the day before before the competition. And so that's the best thing to do. You should be 6 to 8 hours out. Didn't want to belabor that question, but I did want to make sure that you got all the information that is important there. To not treat new customers at shows, I don't think would be the thing to do, because that's what I always did, was treat new customers at shows. but I learned when to treat the animal. And it's also important that the first time you treat a horse, you treat it very moderately. You treat it, you're not trying to give it all the energy in the world. You're not trying to overdo the knees, or not overdo, but really put some energy into the knees or into the shoulders. You want to do a nice general overall treatment and see how they perform, because they will perform better. They will show some improvement 95% of the time after one treatment within 4 or 5 hours, 6 hours before competition or the night before. So I hope that's clear. If you have some points you want to discuss with that, 502-599-9722, and I will certainly answer your questions and have a discussion. Let's see here. Tina asked the question, has a potential client whose horse is being treated with a Bemer and is considering having MagnaWave along with it? Well, the situation here is that a MagnaWave is much stronger than what the Bemer devices are. That's not saying that the Bemer devices are not beneficial and don't work, but if someone's using a Bemer and they're treating it all the time and they want to treat the horse's shoulders or back line before they go to competition, that'd be wonderful. There's nothing wrong with that at all. People are using the Bemer for relaxation and the more long-term, because it takes longer to get the result with the Bemer. That could be a very complementary usage of the device. And so there are some people that they'll treat their horse 2 or 3 times, maybe the week before they go to competition. Then they'll use a low power blanket or a low power device throughout the competition just to continue to support what they've done with the MagnaWave. So can they be used complementary? Most certainly. But do they need to have the low power machine? Not necessarily, because they got the more high power that's more quick to act and give them the reactions that they're looking for. But they can be very complementary, much like the LZR is very complementary to the MagnaWave. How you use them, what you're using them on, and they won't contradict each other at all. And so can they be beneficial? Most certainly. A lot of people do that. Back in the day, we saw a lot of static magnet blankets where they just had magnets in the blankets that they would put on the horse for hours overnight. And they do have a relaxing effect on the animal, and they're okay. And then come back and use the MagnaWave to really make sure that their feet are good before they go jump, to make sure that their shoulders and their backs and their sacral area is fluid and working. And so all that is an important part of what's going on. So we have someone that's calling here, wants to come in. Katie, let's give Katie a call. Here we go. There we are. We'll get Katie on the line and answer her questions and see what she'd like to visit about. Get Katie on the line. Good morning.
Hi, how are you?
I'm good. You want to make sure to turn your computer down because there is a delay.
Okay, I have done that.
Okay, great.
So my question is about children and babies. Like, I'm talking human, but really, I mean, it could be any kind of animal. I haven't seen a lot of information about that on the website or on, the practitioner portal or anything like that. So I was just wondering what are the guidelines?
I'm going to address the mammal part of this when you're talking about young horses or
sure,
the other animals, so on and so forth. How you associate that across the board would be very similar because we're doing the same exact thing. We have treated and dealt with horses, foals that have hit their head and they thought they were going to die, and we would go and treat their head and their neck, and all of a sudden they're up running around and they're feeling much better. We have had animals that have had conditions after they were born, and they needed better blood flow, they needed better blood circulation or potential blood oxygenation, and we've treated horses immediately after birth, all through their youth, and as they age, with very little consequence, no consequence at all. Actually, you're not going to. There's been discussions. Doctors have had discussions about, well, what about the growth platelets? Are you going to interfere with growth platelets and cause stunting or some other kind of conditions that can occur? And my answer would be, or as I've talked with various veterinarians and doctors about that type situation, is if you would take a small dog and put it on the mat and put it every day for 3 or 4 hours and treat it and go on, could there be some reason to question the growth platelets? Potentially. but we don't treat every day in most situations, or at least we don't treat 365 days. We don't treat for extended periods of time. We treat for very short treatment periods to help the joint or help the back or help the nerve, whatever it may be in the animal, so they feel better. And so as far as contraindications, are you going to interfere with what's going on? That's not talked about. Have there been studies on that? I've not seen any studies at this point that have been done on dogs or horses that deal with that. But I know that there are countless examples of when they're treating the animal immediately after birth for joint problems, a broken bone that occurs in the paddock or whatever happens. So there's just a lot of different ways to approach it. The protocols are really no different. Because it's a small dog or a young horse, do you treat for 3 minutes instead of 6? It makes no difference. As a matter of fact, if you treated a very healthy young mammal or person and they don't have a lot of problems, you're not going to see any reaction. You're not going to see any muscle movement. They're not going to feel it as broadly or anything like that. They feel it. People feel it. Animals feel it when they have issues, when they have sensitivity. So again, to go back to that young life, to treat normally, and people have also had that question. Well, because it's a 5-pound dog, should I turn it way down? Well, if the dog is uncomfortable inside the coil, they will leave. And they won't stay there. So, but moderate setting is always beneficial, and you're not going to cause any real issues when you're dealing with that. So the protocols are virtually the same. You just have to understand, that they're younger and kind of approach it like that. But there's really no issue to say, well, I can't treat this. I know Elaine has treated her smaller people with sports soreness and so forth, and to great result. And other people have as well. So when you're dealing with a young animal, it's just treat. You're not going to hurt anything.
All right, fantastic. Thank you.
You're welcome. Is that it? And anything else?
Well, I do have one more question.
Okay.
So I've been using essential oils for a few years now. And have there been any studies done with the combination? Like, does it make the oils more effective? I imagine that it would. And I was, I'm just barely starting on this journey myself. I just got my machine a couple of weeks ago. And so have there been any studies or no? Here's
what happens. Well, again, specific studies with essential oils and PEMF, studies in general are very expensive. I mean, they're really expensive when you start dealing with people, but they're even expensive when you're dealing with animals. So for someone to do a study of essential oils and PEMF, there are probably a bunch of anecdotal things out there. There may be some veterinarians that have dealt with that. However, we do know there have been some extrapolations of studies that topical ointments, because of what we're doing, are better absorbed with PEMF. And so can you improve your absorption if you're what do they call it? The dropping of the oil on the body and where you do it, when you do it, to treat at that point can aid the absorption, the use of the animal of that particular oil that you're using. Is it going to overdo it? Again, no, probably not. But you just want to make sure you do things normally. But it makes sense if we are aiding the absorption of what's taking place, then whether it's an essential oil or a topical medicine that the veterinarian is giving to aid. Now, when you're dealing with medicines, you want to talk to the veterinarian, and so they certainly understand that what you're doing can improve the absorption. They may want that. They may want better than 20 or 30% absorption that they get normally. Maybe they'd be excited to get 40% absorption, or whatever that number.
That makes a lot of sense.
Whatever that number would be. So yes, just simply by pulsing the area, improving the blood flow throughout your blood flows all the way up to the edge of your skin. So if you're putting an oil on it and it's absorbing, and you help that absorption factor, you can maybe very well get better results for what you're looking for.
All right.
Okay, doke.
Well, I think that answers my question. Thank
Great.
you very much.
Thank you so much for calling in. Bye-bye.
Bye.
Great questions. Okay, so we have another, let's see here. The question is, are the Spiro Goes shipping? The answer is yes. When does the free mat promo end? I don't know. Perhaps Chris can find that out for us and post that in the chat box when the free mat offer will end on the Spiro Go. I'm sure Chris can do that and give us that information. So thanks for writing in about that. Bob from Virginia. Let's see. Let's get Bob on the telephone here. And see what he's got to say, what he wants to discuss. Hey, Bob.
Hey, Pat, how are you?
I'm good. You have a question?
Hi. I have a question. I have a new customer, new client on Friday, and it's a complimentary treatment, first time. She saw me treating a friend's horse. And I'm really new at this, and her question was that she wanted me to treat her horse about an hour before she takes it out for a ride. I don't know what type of ride she is doing. I think it's just a walk, but because she wanted to see the difference if the treatment would make treating before she rode.
Not a problem.
And I was listening to your prior statements, and I was just wondering if you recommend me doing that, or should I do it afterwards?
The only time that I would really watch when you treat the horse for the first time is if competition is involved. You don't want to change the horse's attitude or what they're doing prior to competition. You know, in racehorses, they want that edge. They don't want me to calm it down before they go to the track. However, there are some that get real excited and they'd like for them to be a little calmer. But when I first started, I would treat a horse and I'd say, go ride it. And they'd get on that horse and they'd go right to the ring and they'd do something. And as I've said earlier, 95% of the time or more, that horse would come back and they'd say, my goodness, it felt so much smoother. It jumped so much better. It changed leads when I asked it to. It didn't, so things change immediately. Competition's a different story. Because we want to make sure they compete at their best, and we got to treat at the proper time for their best performance. Now, for a trail ride, and she wants to see how it's going to do, treat it. I don't see any issue there. And like I said, for years, I've treated, they get on the horse and they go right out and they come back and they tell me that it's better. I can't say that I ever had anybody say, well, but once in a while, somebody who didn't want to do additional treatments would come back and say, well, I don't know if it did any better or not. Okay. But they would always kind of call back later.
Okay, yeah, because she made a reference to, sometimes when she herself gets like acupuncture, that sometimes she feels really tired afterwards. And my wife is an acupuncturist, so she's going to talk to her about that another day. But I was figuring give the horse a body treatment, full body treatment, and then maybe before the end stimulate the acupuncture points to enhance, to give it some more, and build up its energy, so to speak.
Yeah, I mean, you can treat the energy points on the horse. There are those energy points. I forget what the one is called. They used to. I'll think of it in a minute. But certainly, you're going to treat the acupuncture points as you treat the whole horse anyway. But to come back and key on the set points, great idea and great thing to do. And like I said earlier, 99% of the time I treat a horse, they go out and the horse will be better. And
very good.
And I think you'd see the same thing in a trail riding or whatever it may be that they're going to do. For someone to treat a trail horse and they get on it and the horse doesn't want to go trail ride. Well, I guess that could happen, but horses like to walk and go. And so that shouldn't really be an issue.
Okay. All right. Thank you, Pat.
Okay, Pat. Thanks for calling.
Right. You bet.
Bye-bye.
Happy Thanksgiving.
Thank you so much. Happy Thanksgiving to you as well. Bye-bye. Good questions. And I really appreciate folks who are really getting after us today. Alexandra is here. Let's bring Alexandra on the line and see what she may want to discuss. If you have any other questions, I need to come over here I haven't been over to the restream and see what we got. Oh boy, we do have some questions. I'll come back here to the beginning. We'll get those questions.
Hello.
Hello, Pat Zemer here. How can I help you?
Hi, Pat. I have a very similar question to the previous caller. With race horses. So after the initial treatment, the very first couple treatments where the horses may go through a detoxifying effect, what would you recommend to be the best regimen if they are racing weekly?
If the horse
day before the race, 2 days before the race, assuming that there are no injuries.
Yes, assuming there's no injuries. Day before is what most people do. We learned at the beginning, people were so excited about what I was doing is they'd have me treat the horse Wednesday, Thursday, Friday, Saturday, and Sunday before the Grand Prix. But then as time went on, they learned that, if I treat the horse on Wednesday, it'll pretty much carry it through the whole weekend. Or maybe I got to do it Wednesday and Saturday. And now the horse will do very well through the whole show time. Other people, they would call me, they're going to compete tomorrow, Saturday afternoon. We'd treat the horse on Friday evening or Friday afternoon. And the horse is ready to go at its best performance level. And so that would be the way to do it. So I would think in a racing situation, the day before would certainly most always be beneficial, but you're going to find some horses will respond better if you treat them 2 days before. Each horse is different, but that would be the way to approach it. I wouldn't recommend, which we've talked about, if the horse is going to race today, that you treat it this morning. Because you want everything to get a chance to set in and balance and work that way.
Mm-hmm. And let me ask you one more question.
Right.
So if the veterinarian comes and administers vitamins via IV, is there any period of time that the horse should wait before doing MagnaWave?
If they're giving the horse an injection or an IV type of treatment, best to let it get into the system and do its job. Now, fully understanding if you talk to the veterinarian and they say, okay, we're administering this medication and we would like better application or better metabolization of the medication into the body, the veterinarian may say, so let's treat the horse right away. And we'll get maybe a little better result from what we're looking for with the medication. But as a rule, I would say that if they're giving a medication orally, let it digest, let it get into the system, into the blood flow, then you come back and treat. Or if they're giving an injection, let the injection go, get through, again, metabolized in the body throughout the system, then come back and treat. Now, if they're giving an injection and all of a sudden they get a bulbous or an inflammation or a big area right around the injection, can you go to that and help relieve that and help take that away? Most certainly. And so again, if you're looking at what's going on, what you can facilitate at that point. But let the medication be administered, wait 24 hours, wait a period of time for it to be digested, and then come back and treat.
Thank you very much.
You're welcome.
That was very helpful.
Thank you.
Have a great Thanksgiving.
Same to you. Thank you so much. Bye-bye.
Thank you. Bye-bye.
Great questions, and I appreciate that the questions are being answered, and that's always good. Yeah, John, that'd be a great Christmas present if we get that CE taken care of. Hello from JL Electrotherapy. Northern Lights is with us. Robin's with us. Hello. Steve Spencer, what a great, Steve, thank you. I'm glad you're enjoying the forum and being with us. We appreciate that. Let's see here. I usually don't treat in foal mares. Is it okay to do so? Okay, now, again, when it comes to pregnancy or being in foal, doctors, people will contradict almost everything, whether it's a human being, a small animal, or a horse. A lot of things are naturally contraindicated. But with that said, I mean, I've had situations over the years to where all of a sudden a mare starts to founder, or a mare has got such bad hip pain that it just can't hardly do anything, or its shoulders are bad. And the doc said, look, stay away from the fetus, stay away from the foal, and treat the back hip, or treat the ankle, or treat the front shoulder, so the horse can stay healthy and deliver appropriately. So, it as a rule, you don't want to treat the area. We don't want to move the foal, or the baby. We don't want to have those types of situations occur. So stay away from that type of situation. So again, if you got an animal that is having a problem like that and they're in foal, talk and tell them what's happening. And if it's a hoof problem and you're trying to make it so they can stand comfortably and be able to deliver properly, then I'm sure I would feel pretty confident that the vet would say, let's do what we can do. They'll come do whatever they can do. And if they recommend to do what you're doing to help that situation, I think you're going to have that. So that's the best thing to look at. But typically it's contraindicated when you're dealing with pregnancy, just because you don't want to be the one that, if you're treating and something goes wrong, to be the cause of that. And in Europe, for example, they do things a lot differently with PEMF in some cases, and to use during pregnancy and during foaling type situations is handled different in other places. We're talking about America. We're talking about our veterinary rules and how things are handled in that type of situation. Okay, we'll get to the kidney stones here in just a moment. Let me see what Steven's got for us. Let me bring it up here, get it situated. Hello, Pat Zemer here.
Hey, Pat, how are you?
I'm good. What can I do for you?
Well, I'm listening to you on Facebook. Should I shut this down?
Yeah, turn that down. Just turn your speakers off, because there's a delay.
Listen, we treated the clinic. One of the clinics I work with, we treated two stem cell patients today, and I'm just asking about what the protocol is after stem cell therapy. Can you give me some idea about that?
Well, PEMF, through various studies that have been done through NASA and some other studies, has been shown to improve stem cell development in the body. And so if you're using stem cells and they got a way that they're using them, if they're using them in a specific area of the body, and you're treating the body to get good blood flow around the areas to enhance what's going on with the stem cells, again, you want to talk to the doc. But if you're there and they're stem celling and they want you to treat, the protocol is normal. Now,
so it's just normal protocol. So how many minutes would you treat with the PEMF? We used the Julian MagnaWave today, and this patient had both he had lower back injections, the SI and joints, as well as the facets, and he also had a elbow injection. So how long would you treat? Because I know normally what I've been doing is, for someone who's just to reduce inflammation and that kind of thing, we're just treating them for about 20 minutes over that area.
That's fine.
Yeah, so it'd be the same for this too?
Yeah, I would let it settle a little bit, I would think.
Right.
Let it settle, let it get in. But again, if they're injecting, people used to talk about injecting hocks on horses, and using hyaluronic acid or whatever they're doing, Legend or whatever it may be, and they're injecting directly into the bursa, into the sac of the joint, you treat right, and we would treat right after that, because they had inflammation, they had pain. The inflammation, the injection does not relieve the pain or the inflammation immediately, but we can help that happen. And by going into that, if they're in the bursa or in the sac, it's not going to escape. So you're just you're just treating the area that's inflamed around it, the muscle that's become inflamed, or the tendon, or the cartilage, or the other parts of the body that have that issue. You're just treating to relieve that inflammation, but let it get settled a little bit would be the best way.
Okay, so you wouldn't recommend then doing it right post injection then?
I'd wait a little bit. I'd wait.
Wait a week, because these patients all come back to this clinic like 6 or 7 days, a week later, for a follow up. Maybe that would be the best.
That would be fine. That would be fine. That would be great.
All right. Well, thank you, sir. Happy Thanksgiving.
Same to you. Thank you very much. Have a great day.
You too.
Bye-bye. So I see that Aaron put on the Spiro Go deal ends on 11/30, the 30th of November. All right, kidney stones. Have we found any results with MagnaWave? The issue is with the size of the stone. We've had folks, and we've had where they have those types of indications that that they use MagnaWave to try to get them to move, to pass the stones, so on and so forth. And there have been some promising results with that type of thing. Again, you always want to consult with the doctor involved. If the doctor prescribes that the pulsing may be beneficial to help move things through, you're not going to dissolve any stones. You're not going to break up any stones. So it would be in a situation where the stone is passable, but it's kind of lodged, and we need to get it to go. I'm always comfortable, I don't want to say leery, but I'm always cautious in those type situations, because you certainly don't want to make an animal uncomfortable or a person uncomfortable in a situation. So always keep that in mind when you're doing those types of situations. But there have been folks that have gotten results that they're looking for with MagnaWave and moving those types of objects. Let's see. Amy's with us. Good morning. Hi, Amy. Tina's with us. Good morning. Wendy's with us. Hello. Scotty's with us today. Good afternoon, Scotty. I'm curious about equine tendon injury guidelines. Well, and again, all this is covered in the training, but certainly what we're trying to do when you have a tendon injury is to reduce the inflammation, improve the blood flow around the injury, so you can get a better healing aspect going on to maybe allow it to heal more rapidly because of the better oxygenation, the improved blood flow, the inflammation reduction, so on and so forth. And so been doing it for years when you have tendon injuries to help it heal. And that's basically what you're going to do. Is there a specific protocol? No. Do you treat it longer? No. Do you treat it higher? No. You treat it with a good moderate setting. You change the settings if you're treating it every day so that the tissue does not get used to what's going on. But certainly you got a soft tissue, you got a piece of tissue in the body that needs to heal. We've learned that using the MagnaWave types of instruments improve oxygenation and blood flow, and in fact, in many cases shows that the healing process is enhanced. Basically, we're setting the body up to where it can better heal itself. Same thing happens with the massage, light therapy, whatever, but we are very quick in what we do. We can be very direct in where it goes, and very deep in its penetration. And so that's how it varies in those types of situations. All right, let's see. I hope that helps. Lee asked, I had a vet theorize, admitted it wasn't supported with research, that MagnaWaving joints that have been injected reduces the time that the joint injections last because of the increased blood flow, pushes the injection out of the joint faster, and the injections don't last as long. Have you experienced this at all? What I've experienced is that if you treat after injections, they last longer. The half-life of an injection, I believe, is 85 hours or something like that. So what the injection does, it goes into the body, reduces the inflammation. It naturally dissipates from the body, but it's taken care of the injection. I've had people, and you may have experienced this with horses or animals, they say, well, I inject every 6 months. I do the hocks every 6 months. What they're doing is they're injecting the hock gets healthy, the hock feels good. It takes 6 months for that inflammation to come back because of the work they're doing, and before it starts to show up again. We've learned that if you treat after horses are injected, the treatment may actually last for a year. I've had that happen. And to push it out when the half-life is only 85 or 100 hours, whatever it may be, for that particular injection to be working, if you're treating, you're not going to. If they inject a horse today, and I would treat it today for it not to be viable tomorrow, I've never ever experienced that, and I've been doing this since 2007 or before, and treating horses on the track, in the ring, and that have been injected, and we went right back and began to treat them. Now, if they are treating an area, and now, we're talking joints and tissue, if they're blocking a hoof, if they're putting something into the muscle tissue to help the whole area of the muscle, and they want that to remain there for a period of time, it's not beneficial for you to go treat the hoof if they've done that, because if it's in the soft tissue, not in the bursa, but in the soft tissue, you can help disseminate it out of the area. We've experienced that. They'll block a hoof or whatever, however you want to describe that, but it's not, it's just in the tissue. Well, if you come massage that tissue, you can help push that out, and we've had people that have had that lesson. So perhaps the veterinarian's talking about that type of situation, which could be. But if they're going over the years, when they go straight into the joint, it doesn't go out of the joint. It stays in that bursa. Now, if it's burst and no matter what they do, they can't get the fluid out, or they can't, the fluid just leaves, it's in that type of situation, then you have that situation, and that's an anatomical situation that the veterinarian deals with and needs to deal with even after what we may be doing. But over the years, I've never experienced that type of situation being the issue. Very good question, though, and the way that the vet theorized it. But but they need to come back and look at experience. They need to experience it themselves and understand how it goes. And we've learned so much. A lot of people operate on the premise that they're going to inject an area, going to inject a hock, or going to inject an area of the body, and they say, well, let's wait 24 hours. Fine, perfect. Some people say, let's wait 48 hours. Perfect. Because a lot of times it takes that long for what they injected to be disseminated in the body and the result to be there. And what you want to do at that point is support the result. We want to support anti-inflammation. So if they take away the inflammation with the injection, and we can prolong that inflammation being removed by continually to treat, then they need that injection less often. And as we all know, and the discussions have come up with a lot of different people, you can only, it's not that that it's proven that you can only inject a horse so many times, but that comes up in conversation. You don't want to, the more you inject an area, the more you run into the problem of potentially having a problem as a result of continual injections. Now, some people never have an issue, or some animals never have an issue with injections. Others do. Something gets nicked, something wrong place gets hit, whatever it may be, there could be problems. So if we can prolong and set apart the number of injections that are needed in those types of situations, typically is looked on as a pretty good situation. So I hope that helps. If you're not clear, put another question in here or give me a call and we can discuss it. Let's see. Tendons, we got that. The joint, we got that. Aaron's replying to a question. I purchased an Equisports massager to add 2 services. Is it okay to use both during the same session? Yes. If you're massaging with an Equisage type of machine, and then you're coming back and you're MagnaWaving complementary, it's fine to do that. You might set them apart and do one before. I've had chiropractors that have used MagnaWave prior to the chiropractic adjustment, and then they come back after and treat for 15 or 20 minutes to help get rid of the inflammation that was there. Quite often when they put them back in alignment, that doesn't take care of the pain and inflammation immediately, but this can help that along to where it makes their adjustment better or more effective. And so the same kind of thing with a massage. If you're doing that, a lot of people have used the TheraPlate type of device, and they'll give that vibration treatment to an animal and then come back and treat. Remember, what we're doing is improving. A vibration will improve blood flow, certainly, but we are improving, we work to improve the oxygenation, to improve the blood flow so the blood cells are more healthy, to better do their job, to allow the body to better heal itself. And so any other complementary things along with that can be considered very beneficial if your clients want to use the two together or whatever. Perfect, not a problem. Hey, Jim, hello, how are you doing? Let's see. MagnaWave use on horse with kissing spine. Any advice? Yes, treat. And treat as often as you can because what you've got is an irritant there that's causing pain, causing inflammation because of the proximity of the spine and how it reacts and the weight of the rider or what type of competition it's in. So I would do it as often as possible. You might want to learn what's the best time to administer the therapy prior to riding, prior to competition, also after competition, to treat the area to get rid of or help the body get rid of any inflammation that occurs during the competition. So you want to, and that comes with time. You're going to figure that out over time. And again, each animal is going to be different. So you're going to handle each one differently to better suffice as far as their recovery is concerned. When I first started, it was all about make my horse jump higher, run faster, run longer, whatever it may be. Then it became help my horse recover. So when I get back to training later this week, he or she's ready to go and be as efficient as possible in the regimen. So it went from make me go faster to help me recover so I can go fast again. And, you know, those are the kind of things. I had the guys come over from Dubai a couple of years ago and fly in and kept telling me, we want our camels to be able to run as fast as the Sheik's camels. And the Sheik's beating us all the time. And I said, look, I can't really make your camels run faster, but I can help your camels run fast longer. And quite often that's the difference. It's maintaining that speed, maintaining that durability that you need, that stamina that you need. And the same thing holds true with any type of animal athlete or even human athletes. We want to help them maintain stamina, have good oxygenation in their lungs, have good, no pain, better movement in their joints so they can better go do their job as they make those jumps or whatever they're doing. So that would be the way to approach, in my estimation, a kissing spine type of situation. Okay, let's see. Plantar fasciitis, my left foot is killing me. And as a pet farm sitter, I am busy. I am in my busy season. I can't afford to be limping around. I'd treat yourself twice a day. I'd put your foot, your ankle and your foot inside the butterfly loop, put it as high as you can comfortably, and I'd treat yourself pretty often to get ahead of it. The problem with that, it being an inflammation, being a very tense situation in the body, is that you're going to walk as soon as you're finished. You're going to move around. So you want to do it in a recovery mode. You want to do it at the end of the day and at that type of situation so you can recover and so you can keep it in a good situation. If you have a chronic situation, it's going to take some time. So again, having a machine, I would do it maybe 3 times a day, certainly before you go to bed, so you can sleep comfortably and when it's in a relaxed state anyway, and you're not around walking and chasing animals, so on and so forth. But that would be the way to approach it. And again, every person is different. What's causing it? What caused it to begin with? Is it anatomical? Is it from stress of the walking or whatever it is? It's going to add to it. So it could take some time to get ahead of it. But I would get after it as often as you possibly can. Great question. Let's see. I recently worked on a horse that the vet said where hip meets the back had an issue. Was on muscle relaxers. I have no movement anywhere on the horse except on the opposite side in back and neck. Why? Well, quite often what's happened, if they're on muscle relaxants, that doesn't mean that what's causing the problem isn't still there. And horses quite often refer pain to other areas. So while this is being medicated or this is working over here, the fact that the way they're walking or carrying themselves is showing pain or showing sensitivity in the shoulder or showing sensitivity on the other side, because it will refer pain or refer sensitivity to other areas. And so that's how you want to approach that. And that's why that will quite often show up. My story is you put the wrong kind of shoes on and you go to the state fair when they start having state fairs again. They are, some places are, but you go to the state fair and you walk around all day long and you come back and your neck's killing you. It's because of the shoes and the way you walked in the shoes, the way you carried yourself, your gait, because the shoes were not comfortable. The shoes, you know, you should have worn another shoe. And we all know that. But sometimes we forget. And so your neck's hurting and you're treating your neck and it's hurting, but you don't realize that it came from your shoes because of the way you were carrying yourself. And that's what quite often happens with an animal in that type situation. Hope that helps. If it did, great. Let's see. Aaron's back on there doing some things. I have some ideas about plantar fasciitis. If you reach out, if you like, great. Reach out to Stephen Spencer. Can MagnaWave treatments help get rid of scar tissue from an old injury on a horse? What it can do is is it going to eliminate the scar tissue? Probably not if it's an old injury. The scar is there and the scar is there. But sometimes a scar can be limiting. It can be hard. It can be causing constriction in a particular area. I've had it in horses, racehorses particularly, where they've had an injury on an ankle, and all of a sudden they've got this bulbous piece of scar tissue, and it's as hard as a golf ball. And we've been able to go in and soften it up to where it's more pliable, allowing them to have the range of motion that they want them to have, and therefore they can compete and perform. So it's not going to eliminate it. Now, if you have an open wound and it's going to scar, to treat that area can reduce potential scarring that would normally occur. It can produce proud flesh, reduce the occurrence of proud flesh. So and we do a lot of work in plastic surgery type situations where we don't want scarring. We want the blood flow to be there, the oxygen to be there, to where there is less scarring wherever the surgery's been done. And on an animal, if they're doing something to the face or head, to treat that area so they don't have scarring, so they don't have those type situations, can certainly be beneficial. Let's see. Can MagnaWave scar tissue? Dolores, you're welcome. Thank you. So, folks, if you have another question, please put it in the chat box. My goodness, time has flown through here the way it's going right now, and that's great. That's a good thing. Always want to answer these questions, and it's been a good program today thus far, so I really appreciate that. Had some great questions, and always fun to do it. Sometimes it's a little repetitive, I feel, on my part, because I'm sharing stories that I've had over the years and what to do and how to do it, or how I've experienced it from the beginning. And when I started, there weren't many people doing this east of the Mississippi River, or a lot of people around the country. It was a little deeper in some doctors' areas, and there were some spots on the West Coast where it was being utilized. The old machines were heavy, expensive as hell. I mean, really expensive, $60,000, $75,000, $80,000 for some devices. And so, you know, things have changed dramatically, as you very well know. So if you have another question, please post it in Facebook or YouTube, and I'd be happy to have a look at it and answer the question. If not, I won't keep you here all day long. I have a doctor's appointment in a little bit. I got to get my right eye released. As you know, I did cataract surgery, and this is interesting. I'll share this story with you. I did cataract surgery. I told my doctor I was going to use PEMF. After my second eye, they did each eye 1 week apart, so I only had to do one COVID test, and so they did them 1 week apart. And after the second eye, the day after, he released me for a month, because they were both doing so well in the healing process. I was seeing 20, 25 almost immediately, and I treated myself with the drops that they had us use, but then I would treat myself twice a day with the MagnaWave, simply putting the butterfly coil right up to my eyes and treating. I did the same thing with the LZR. I would come back and treat my eyes with the LZR closed, my eyes closed with the LZR, and he was very impressed with how things were moving along. Then I went back for my 30-day, and my right eye had occurred, some inflammation had occurred, and he wanted me to go back on some drops in my right eye, and he said, it's going to take you a full month probably. We may have to go in and do a steroid shot to get rid of that inflammation. And I came home, started doing the drops, using the machine daily, again, on my head and eye, and within a week I was seeing fine. You know, I can look at my phone, close each eye, and be able to tell how I'm doing with improvement, because I'm not blurry over here because of the inflammation. And so I was very pleased that it's happened so rapidly. I feel I'm going to go back today here in about an hour, and they're going to test me, and everything's going to be fine, and then he'll release me, and there you go. And I've used my equipment. He knows what I'm doing. He knows I'm going to use it. In fact, he looked at me when he said, boy, they did another test, and the inflammation was pretty severe in the eye that they did. And he said, so I'm going to give you these drops. And he said, I guess you're going to use your machine. And I said, of course. And he said, okay, let's see how it does. And so that's been exciting. And it's been exciting to work with a doc that is open enough to not say you're crazy and don't do that and so on. He's been very open to, Debbie and I both had this done at the same time, and she's had the same type of speedy results that they wanted. And so we've been excited about all of that as well. Okay, any other questions? I don't see anything else coming up at this point. So I'm glad you've been here. I hope the information was suitable for what you need to know and like to know with regard to MagnaWave. Those of you on Castbox, thank you so much for being with us today. And those of you on Facebook or YouTube, thank you for being with us. It is Thanksgiving week, so I wish you a very happy Thanksgiving and to be with your family. I know that's being limited all over the country as to what you can do. So call your loved ones and family and share with them and have a great time. Again, happy Thanksgiving. Holidays are approaching. Have a great holiday, and it warms my heart to be here with you, and I appreciate that very much. So wave on to better health and wellness, and have a great holiday and a great day. Talk to you later. Bye-bye.